I had pain that presented itself as like a sciatic issue. The pain in the leg was like excruciating. And I was becoming very debilitated in my ability to walk around. I couldn't do my day-to-day chores. I own horses, so my farm work, my farm chores are my entire life. I really wasn't able to maneuver very well, wasn't able to cook or participate in family activities because I had to have the ability to lay down. I couldn't stand for any length of time. It became very depressing. I had to go on pain medication. I was reliant on that pain medication. I did do a couple rounds of injections. The injections were not working. Pain medication, although subsided some of the pain, didn't really solve the problem. And mentally, I was deteriorating. There really was no answer, so I was desperate.
Hello.
Hi, Dr. Basques.
How are you?
Pleasure.
Dr. Bica was great, recommended me to Dr. Basques.
I first met Wendi when she was referred to me for severe leg pain. And this is because she had a disc herniation in her spine that was pushing on the nerve that went down her leg. Typically, we like to stay conservative when people show up with this type of disc herniation. We do things like physical therapy, anti-inflammatory medications, we try injections, but she'd already tried all of those things. My area of expertise is actually in minimally invasive spine surgery, and so using small tubes or cameras to clean out pressure on nerves. I knew based on exactly where her pressure on her nerve was that she'd be a great candidate for an endoscopic procedure.
He seemed very confident. He felt that he could solve my problem. I felt that I fully trusted him and the team.
Wendi's disc herniation was in a very challenging location to treat with traditional spine surgery. Historically, the only way to treat this is with a fusion surgery. It's a big surgery, it's a very long recovery. Now there's technology where you can actually put what's called an endoscope inside the nerve tunnel itself through a tiny little poke hole, and you just clean out the disc herniation and get out. It's very fast, very quick recovery. This type of surgery is only done by a handful of people in the country, and I've been very, very satisfied with my results so far.
So I was like, well, I'm all in. I was sold.
One of the advantages of being at University Orthopedics is that we have a wide area of expertise as a division. Whenever you're thinking about a surgery, is you want to go to somebody who's an expert in whatever procedure that you're considering. And within medicine, within orthopedics, within spine, there are certain procedures that are really only done routinely by a handful of people, and typically you want to go to someone who is experienced in the latest techniques and the technologies, and who you know is going to do a very good job with this procedure.
Everything was done locally and right at Rhode Island Hospital, so it was very simple. Very convenient. He came in and he's like, we're gonna do this, you're not gonna have a problem, in and out, and that's exactly what happened. He went in and shaved off a piece of my disc that was sitting on my nerve. And when I tell you that was a game changer, there was no downtime, there was no soreness. Today I'm back to my barn chores, riding my horse, going back to the gym, those heavy wheelbarrows, lifting 65-pound hay bales.
Wendi is an incredible patient. It's fantastic that she's able to do all of those things without having to worry about her back and her pain going down her leg. All I can do is take pressure off a nerve, and it really is up to her to take it the rest of the way, and you can clearly see she's done a fantastic job.
I felt I had no options, and he gave me an option, and he gave my life back, which is a big deal for me.
Severe pain, it can be incredibly depressing, it can be debilitating, and when you're able to transform that into suddenly able to do all the things you like to do again, you can see not only there's a physical improvement, but an emotional improvement, and you see it in her face. This is what makes what I do incredibly rewarding.
The injections, it's just masking the problem. This fixed the problem. What a life experience. It's just been phenomenal. It really has changed my life.